Okay, so we'll go ahead with my talk on differentiating true from pseudo-optic disc edema. At the outset, let me tell you what is a normal optic disc. Okay, normal disc is not just 0.3 to 0.4:1 cup. Okay, it is much more than that. A normal disc has a well-defined margin, there is a presence of cup, and the nerve fiber layer is transparent, and you may see pulsations of retinal vein. So all this will comprise a normal optic disc. When there is swelling of the axons, then we get true disc edema. So papilledema is one subtype of true disc edema where there is optic disc swelling due to raised intracranial pressure. And if the rise in the disc or swelling in the disc is not because of axonal swelling, then it is a pseudo disc edema. So we need to differentiate between whether there is axonal swelling or no axonal swelling when we have to decide the disc edema is true or pseudo. So if I show you these two photographs, it is very easy to say that the discs are hugely elevated, and you may intuitively say that these are true disc edemas. But if I show you something like this, then we have to think, we have to put a reasoning process to say what is happening here. And the reasoning process consists of symptoms, signs and investigations. Patient may have symptoms suggestive of raised intracranial pressure or an inflammation in the nerve or an ischemic process in the nerve. But in this talk, we will concentrate more on signs. And when we say signs, it means optic disc examination, which plays a major part in signs for this distinction. So before I go into that, a word of caution. If we have to see disc, we must use one of these three lenses and see disc stereoscopically. Only then we can assess the depth or have a stereo perception. We should not use a direct ophthalmoscope. Now when we talk about optic disc examination, you must have seen this template, especially in books, and that template is one which we can use for any optic nerve and try to distinguish what the process is. So I will show you what all to look for into the template to do this distinction. So the first thing says size, shape and margin. What is more important for us is the margin. See that this disc has a blurred margin, and that is one important sign of true optic disc edema. Next thing, we look at the neuroretinal rim, and the neuroretinal rim, what is more significant for us for this topic is the color of the rim. See that this rim is pale, and we also need to see the cup. If the disc is small, the cup is obliterated. Then we come to the surface of the disc. On the surface, not only hemorrhages, you may have exudates. Like this is a typical glaucomatous disc with a splinter shaped hemorrhage, and this is a swollen disc with multiple hemorrhages, and as well as there are hard exudates. We should also look for vascular signs like absence of pulsations or dilatation of veins. So all these come into the surface of the disc. And then lastly we go to the peripapillary zone. Peripapillary zone does not mean always that there are RNFL defects. It can also mean that there is opacity of RNFL. This RNFL around the disc is opaque because it is edematous. Or there are patterns lines when the edema is resolved. This is a sign of resolved optic disc edema. So basically this template is telling us what all to look for into each step of the template. Fine. Now we take a note of all these points, and I will show you how to integrate all these points that we have seen. So let us take this example. This is a middle-aged lady who had headaches, diffuse headaches more in the mornings, and we see the disc, both the discs are swollen. Now we see the margin of the disc is blurred. Why this is blurred? Because the axons are swollen. Why they are swollen? Because there is raised intracranial pressure. So basically there is swelling of axons. When there is swelling of axons, there is blurring of disc margin, and there is obscuration of vessels. You may see the large vessels through the margin of disc, but the medium or small vessels we cannot trace because they are obscured, because there is edema of the axons. You also see some hemorrhages and you see engorged veins. These are again because of the vascular signs are because of raised intracranial pressure. Another example, both discs are swollen because there is edema of the nerve fiber layer, the disc margin is blurred, and you again see vascular signs like hemorrhages, exudates and leakage from the disc. These are all signs of true disc edema. The most important sign or one of the most earliest sign is blurring of disc margin, and then all other things are related to this sign. Now if this edema is not resolved in time, what will happen is the disc will start becoming pale. If you see this, the rim is pale, and then you may have these tiny exudates here. These are called pseudodrusen. This is because the disc edema is not resolved in time. Let us take other examples. Now in this disc, the disc margin is again blurred, slight blurring because the edema is not much. But if you compare this with the other normal eye, here you see normal striations of the nerve fiber layer, whereas here there is subtle edema of the axons, and that is why the disc margin in this segment is blurred compared to this margin, and you can see that there is slight edema here. Another example, little more edema. Both these are called mild disc edema. Again, disc margin is blurred here, and you see these lines. These lines are there because there is fluid. There is a hole in the retina, and you see this blurring of margin, or you see opacity of retinal nerve fiber layer. This nerve fiber layer is opaque. Another example, little more advanced edema. Look at this nerve fiber layer. This nerve fiber layer is opaque. It is not transparent. That is where I am stressing. This is an opaque nerve fiber layer. There is a tiny exudate here. Veins are engorged. These are all signs of true optic disc edema. In addition to this, you may have some associated signs which may help you. Like in this patient, there is edema, there are hemorrhages, but the disc, the rim is pale. So this indicates an ischemic process. Or you may have macular folds and a classic retinal nerve fiber layer defect, wedge shaped. So this was a patient of glaucoma, and he had anti-glaucoma surgery with hypotony that has caused these folds and disc edema. So the associated signs to the disc edema can also give clue in your differentiation process. Now in contrast to all these images that I have shown, look at this. This disc, it looks elevated. The temporal rim looks pale, but that's an photographic artifact, so take it as a normal temporal rim. You see that the disc is elevated, but how is the nerve fiber layer? The nerve fiber layer is transparent, it's not opaque. Just compare this with the previous example. This nerve fiber layer is opaque. This nerve fiber layer is transparent. This is not edematous. This is elevated because the disc is obliquely inserted. So if it is oblique, the nerve fiber layer has to climb to reach the disc surface. That is why we see this. But whereas here the nerve fiber layer is not elevated because the disc is oblique. So this is not true disc edema, this is a pseudo disc edema. Another classic example, hugely elevated disc. But look at the margin is so clear. The nerve fiber layer is transparent. There are no exudates, no hemorrhages. So this is again a case of pseudo disc edema. There was a drusen in the disc which was picked up by the CT scan, and that was causing elevation of this disc. Just look at the margin of the disc, look at the nerve fiber layer, look at the vascular signs, and then we can distinguish. Another example, localized irregularity in the margin of the disc. There is peripapillary atrophy, there is alpha zone, and the disc margin is clear. This is a drusen which is picked by autofluorescence. So these are all examples of pseudo disc edema. Small discs may appear swollen, but the nerve fiber layer is transparent, not opaque, confirmed by FFA. Another case of pseudo disc edema. Middle-aged man, the neuroretinal rim looks pale, but these are myelinated nerve fibers. This is not swollen axons. These are all examples of pseudo disc edema. So in nutshell, in a case of true disc edema, there is blurring of disc margin, there is obscuration of vessels when they cross the disc margin, there is venous congestion, and the vessels are normal except for dilatation. Thank you for your attention.